My name is Jody, and I am a Bernie delegate from Oregon.
Hi, I'm Ashley Pelton. I'm a social worker and a recently elected Bernie Sanders delegate for Oregon.
My name is Valdez Bravo, and I'm a Bernie delegate from District 5 in Oregon.
Hello, my name is Angelique Gorman, and I'm in Eugene, Oregon.
Hi everybody, my name is Heather Bishop, and I'm a Bernie Sanders delegate to the Democratic National Convention from Oregon.
My name is Jim Couples, and I am a Bernie Sanders delegate to this year's Democratic National Convention.
I'm Emily Gibson, CD2 delegate for Bernie for Oregon.
Hi, I'm Lisa Stiller, a Bernie Sanders delegate from Oregon 1. I support Medicare for All, a comprehensive, universal healthcare system.
In America today, nearly half of all adults are under or uninsured.
We're the richest nation in the world. And yet, out of the 11 industrialized nations, we have the worst health outcomes for our people.
I'm a born and raised Oregonian, and I see my community suffer every day.
I am advocating for healthcare for all because as a teacher, I see far too many families that are struggling to make ends meet, struggling to pay off medical debt, or just struggling to keep jobs that actually have health insurance benefits.
Since the coronavirus has hit, millions of Americans have lost their jobs. That's millions of Americans without insurance during a pandemic.
Millions more have health insurance that's so bad with deductibles that are so high that they can't access health insurance.
Because there's a lot of people out there with a lot of barriers to access, whether that's financial or cultural, or maybe the services just don't exist in their communities.
We have some of the highest infant mortality rates of all the countries in the world. So when they say that we have the best healthcare in the world, it doesn't matter if you can't access it.
Several years ago, I delayed getting treatment for skin cancer because no one would see me because I lacked health insurance. The result was I needed more aggressive and more costly treatment once I did get care.
A good friend of mine, Lyle Edelman, passed away last year due to cancer. He avoided going to the doctor for years, and that was just due to expense. And by the time he did go, he already had stage 4 cancer, which had spread from his lungs to his brain and to other vital organs.
Half of my friends make too much money to qualify for the Affordable Care Act plans, but they work in the service industry, which often provides little to no healthcare options for them. What little services they are able to get often means long wait times, commute times, and often very expensive out-of-pocket costs.
It's a huge drag in our economy for many entrepreneurs and people that work in rising industries to have their health care shackled to their employer. How can you really strike out on your own if you're tied to your employer?
The U.S. now has 27 million people who lack health insurance, 8% of our population. 23% are uninsured. That's 44 million people who also have trouble accessing care.
I myself am not insured, which is something I'm not proud to say.
We're also spending more than every other country in the world for the same health care.
We spend 18% of every dollar on overpriced healthcare, and that cost is only slated to grow to 30% of every dollar by 2050.
My dad's a veteran, and he happens to have guaranteed medical health insurance through the VA. And he's definitely had to use it. And I'm really grateful that we haven't had to worry about deductibles and co-payments and premiums, because that would have added a lot of stress to our lives.
It's not that our doctors and our nurses and our hospitals aren't awesome. They are. The problem is people don't get to access it. And really the reason for that is that healthcare is a profit center in the United States, not a service that we offer our people. That's broken in about 7 different ways.
And in America today, we all know that healthcare policy is not written for we the people, but by special interests in Washington.
Bernie Sanders has been talking about this for decades. We need to step up with the rest of the developed nations and offer health coverage to our people.
I'm here to support Medicare for All because I do believe that health services and mental health services should be a human right and not just a privilege.
We are a wealthy first world country, and we should bring everyone along with us. And that's why I support Medicare for All.
I do believe that it's possible for our nation to implement Medicare for All because not doing so only guarantees that our sick and vulnerable people like my dad would just continue to fall through the cracks of the current healthcare system or be buried by medical debt.
The Medicare for All proposals that are out there are really good. House version is actually outstanding.
The answer, my friends, is to sign on to supporting Medicare for All.
Everybody in, nobody out.
Everybody in, nobody out.
Everybody in, nobody out. Don't bankrupt the system. Let's fix the system and make sure that we all get the care we need.
Medicare for all. It's time.
Because being poor should not be a death sentence.
Healthcare is a human right. Support Medicare for all.
Stand with us in support of Medicare for all. Thanks.
I hope you'll join me in supporting Medicare for all so that our country and every citizen has access to affordable health care and medical services. Thank you.